Hi, and welcome to A World Without Malaria. In the first 4 modules of this series, we focus quite heavily on the mosquito, but in this module, we'll discuss anemia. When considering malaria, it's important to understand anemia as it's almost always present when people have malaria. Malaria causes anemia, but there are other causes as well. Many of them can be prevented. I'm sure you'll learn a lot from this short presentation as we investigate a little bit more of the complexity of creation in the human body. Enjoy.
Hi, my name is Jimmy. Let's talk about anemia. Anemia is a major problem that occurs when someone suffers from malaria. Anemia occurs when you don't have enough red blood cells in your blood. Red blood cells contain hemoglobin. Hemoglobin is the delivery agent for oxygen contained in the red blood cells. The red blood cells transport the oxygen from your lungs to all the places in your body that need it. But when there is a shortage of red blood cells, or hemoglobin, your organs and tissues miss out on the oxygen they need. Of course, the human body is miraculous, and in this series, we are not attempting to be a medical authority. But if you would like to know a bit more about blood and the different types of blood cells, have a look in the appendix section of your manual. Now, in general, anemia is most common during infancy, pregnancy, and old age. And if we recognize it early, it can be easily treated. But the reason malaria causes anemia in all age groups is because malaria parasites destroy red blood cells. When the red blood cells are destroyed, both iron and oxygen levels in the body reduce and anemia occurs. In a severe attack of malaria, up to 50% of all the red blood cells in the body can be destroyed within 24 hours. This is life-threatening. Okay, let's look at the signs and symptoms of anemia. How can you tell if someone has anemia? Well, firstly, the person will look paler than normal, and this can often be seen by looking at the gums in their mouth or under their lower eyelid. The palms of their hands and the skin under their fingernails can also be a good indicator. The person with anemia will also be lacking energy and be more tired than normal. In severe anemia, the person may also be easily breathless and faint. This is because the red blood cells carry oxygen around the body. And when the red blood cell level is too low, the oxygen levels are also too low. People will breathe faster to try to get more oxygen into their body. You can see here how oxygen, which is breathed into the mouth and nose, goes into the lungs. The oxygen is then transferred into the blood through tiny sponge-like cells called alveoli. In this clip, you can see an illustration of the heart pumping blood around the body. In order to get enough red blood cells containing oxygen around the body, an anemic patient's heart has to pump faster, so the pulse rate will be faster than normal. In Chapter 9, Malaria and Vital Signs, we discuss what a normal pulse is and how to count it. We also describe how to read a pulse and other important diagnostic techniques. In a severe case of anemia, the feet and ankles may become swollen and heart failure can occur. People with anemia are more likely to get sick. This is because when the cells of the body do not get enough oxygen, they are not able to work properly. A breakdown of tissue occurs. The immune system does not work well, and the person gets sick from other diseases. The immune system is a network of cells, tissues, and organs that work together to protect the body from disease. This is explained in a bit more detail in the appendix of your manual. So, in short, a person may well have anemia if they have symptoms such as being paler than normal, or they are tired and weak, or have a fast pulse and breathlessness. It is best to detect anemia in the early stages and, if possible, confirm it with a blood test. This blood test can be done in a laboratory with a microscope or with a simple hemoglobin test kit. Now you can learn how to use a hemoglobin test kit in Chapter 6 of this series. Starting treatment for anemia early can prevent the more severe effects of the disease. We will discuss treatment a little later in this presentation. Okay, now let's examine in a little more detail what causes anemia. We have already mentioned malaria, but I want to look at some other causes and divide them into 3 categories. The first category is when the body does not make enough red blood cells. Anemia will occur if a person's diet lacks iron, vitamin B12, vitamin C, and folic acid. All of these are needed to manufacture red blood cells. Do you remember that I said anemia can be a problem for infants? Well, this easily happens at around 6 months of age if iron-rich foods are not introduced in their diet. Also, some illnesses such as kidney failure, cancers, and HIV/AIDS will stop the production of red blood cells. Remember, I also said that pregnant women are more likely to develop anemia. Well, this is because the production of red blood cells may not keep up with the increased blood volume the pregnant woman generates in her body during pregnancy. Her blood becomes more diluted and anemia can occur. The second category or cause of anemia is when there is a high rate of red blood cell destruction. You know from my earlier statements that malaria falls into this category, but there are other illnesses that also destroy red blood cells, such as sickle cell disease. And now the third category. Blood loss is a cause of anemia. The blood loss can be acute or sudden, as a result of injury like a severe cut, or from a major nosebleed or severe internal bleeding. It can also be chronic, which means over time, and is caused by slow, long-term, ongoing bleeding, such as heavy menstrual bleeding or hookworm or diarrhea with blood. So, we can see that anemia is a serious condition. The question is, how do we manage and treat this condition that has the potential to be life-threatening? The destruction of red blood cells caused by illnesses like malaria is a source of anemia that needs prompt treatment. For example, if a person has malaria, it is important to start the correct course of malaria medication as soon as possible. This will stop the malaria parasites from destroying more red blood cells and allow the body to begin the healing process. Separate medication to specifically treat anemia is often taken after the malaria medication treatment is finished. Don't take these 2 medications at the same time. We talk more about malaria medication in Chapter 13. A person suffering from malaria may or may not have poor nutrition, but good nutrition is vital in both treating and preventing anemia. Mineral iron is found in red blood cells, so it is important to eat foods rich in iron, such as red meat, liver, the yellow of eggs, fish, dark green vegetables, oilseeds, nuts, and beans. Vitamin-rich foods are also important, particularly foods containing vitamin C and vitamin B, because these vitamins are needed to make more red blood cells. Vitamin C is found in citrus fruits like oranges and lemons. It's also found in vegetables. Vitamin B is found in meat, liver, eggs, wheat, and rice. Folic acid is also essential for the production of red cells. Eating foods rich in folic acid is important. For example, liver, kidney, fresh vegetables, fish, beans, and ground nuts. Avoiding drinks with caffeine is helpful because caffeine can prevent the body from absorbing iron, which is needed to make red cells. Tea, coffee, and Coca-Cola all have caffeine. So please, if someone has anemia, explain the problem and advise them not to have these common drinks. Sometimes, even if a person's diet is good, it will be necessary to add iron and folic acid tablets. Pregnant women often need to supplement their diets in this way. Breast milk provides good nutrition for a baby. All the baby needs for the first 6 months of life is breast milk. We have an entire chapter on nutrition, so be sure to see chapter 7 for more information on this important subject. As mentioned earlier, blood loss is another reason anemia develops, so it is important to identify the cause of bleeding and stop it as soon as possible. This may require help from a doctor or nurse to identify the cause of the blood loss and give the correct medication. For example, as in the case of hookworm. As we conclude this teaching on anemia, remember, it is the most common disorder of the blood, affecting about 1/4 of the world's population. It raises medical expenses, reduces work capacity, and can lead to serious illness and death. So don't forget, anemia is a significant health issue that is often triggered by malaria, which destroys red blood cells. And also remember, anemia can result from other factors, such as poor red blood cell production or blood loss. An anemic patient will often have paleness, tiredness, and shortness of breath. And finally, remember, it's important to address the underlying cause of anemia and also ensure proper nutrition that is rich in iron and vitamins. Thank you for listening. Take care and bye for now.